All right, Ash, are we good to go?
We are.
All right, good morning and good afternoon, everyone. I'm Lindsay Listansky. I am the chair of What Moves Her. For those who are new here or just need a refresher, this is What Moves Her, and What Moves Her was founded by Sue Yannicone about 5 years ago. We're celebrating a pretty big milestone this year with the intent of really fulfilling women's personal, professional potential. And one of the things that we really focused on this year is health and wealth. I was at a conference last week and someone said a quote in the room and I loved it and I wrote it down in my notebook. And they said, do something today that your future self will thank you for. I don't know how often women pause and really take the time to focus on their health and wealth, but I would bet it's not super high on your priority list, and it definitely should be. So this is what this event is all about, a special What Moves Her event completely focused on owning your health and wealth. And do we have a delightful and incredible gift of a guest? I want to welcome Dr. Tracy Verrico. Now, let me brag on Dr. Tracy a little bit. She's a board certified OBGYN. She is a hormonal health expert, a wealth educator, and a self-made real estate millionaire. She's been featured on ABC and in Forbes. She's an international speaker. We were just talking backstage about how many conferences she's done this year. And she also recently launched a program helping women to take control of their health and finances. She could not be more appropriate for today's event, and we are so proud to call her part of our Anywhere and Coldwell Banker Realty family because she's also a Coldwell Banker Realty agent in the Pascack Valley, New Jersey office. Please welcome my new friend who I absolutely adore, Dr. Tracy Verrico.
Hi, everyone. And thank you, Lindsay, for your kind introduction and for inviting me to join this conversation today. I'm grateful to Coldwell Banker. Shout out to Pascack Valley and the What Moves Her community, and for this opportunity to speak with you all today. It's truly a privilege, and I want to welcome you to Owning Your Health and Wealth today. So I believe there are three essential pillars for health: physical, financial, and social. They are deeply interconnected, and one cannot truly flourish without the others. So when we strengthen one, we nourish them all. My vision has always been rooted in seeing women thrive in every aspect of their lives. And my mission is about helping women align these pillars so that they can step fully into their vitality, confidence, and power. So today's session, you're going to provide evidence-based strategies to protect your body and your bank account. So I just want to start with the information that's provided today is really for educational purposes only and is not intended to give you medical advice or financial advice. I always have to give these disclaimers, but always consult with your healthcare provider and your financial advisor when you're seeking advice for your individual needs. So here's the roadmap for today's journey. I'm going to begin with the evolution of menopause, covering history, definitions, the common myths, and the benefits of hormone replacement therapy, known as HRT. And then we're going to explore financial health and how financial literacy shapes your overall well-being. And I'll conclude by demonstrating how integrating physical and financial health fosters a stronger, healthier, and wealthier you. So let's begin with your physical health. About 1.3 million women in the United States enter menopause each year, which equates to one woman entering menopause every 25 seconds. Women spend 1/3 of their lives in menopause. Unmanaged menopause symptoms cost women and their employers billions of dollars annually in lost productivity. So let's start with some basic definitions. Perimenopause, which is also known as premenopause, is the transition before menopause when estrogen and progesterone levels made by the ovaries begin to fluctuate unpredictably, causing irregular menstrual cycles and a wide range of symptoms. Perimenopause can start as early as your mid-30s and can last 4 to 10 years before reaching menopause. The most commonly known symptom is heat intolerance, like hot flashes or night sweats. But there are over 100 symptoms, some of which are headaches and migraines, dizziness, mood changes, anxiety, depression, changes in your skin, hair thinness, hair loss, difficulty sleeping, ringing in your ears, facial hair, joint stiffness, aches and pains, heart palpitations, problems with your memory, trouble finding your words, brain fog, urinary tract infections, urinary leakage, reduced sex drive, even vaginal dryness, and pain. Menopause is the natural biological process marking the end of a woman's reproductive years. And this transition occurs due to the decline in reproductive hormones, primarily estrogen and progesterone, by the ovaries. It's defined as the point when a woman has not experienced any menstrual cycles for 12 consecutive months, and the average age of menopause is 51. Menopause and hormone therapy are not new concepts, yet because women have long been underrepresented in medical research, menopause care has faced decades of neglect and repeated setbacks. The term menopause was first coined in 1821. By 1942, Premarin, a prescription hormone, entered the US market. In 1984, the National Institute of Health confirmed estrogen as the most effective way to prevent bone loss. And by 1990s, the major health organizations, including the American Heart Association and the American College of Obstetrics and Gynecology, endorsed estrogen therapy. Then in 2002, the Women's Health Initiative Study, or WHI, falsely linked hormone replacement therapy to higher risks of heart attacks, strokes, blood clot events, and breast cancer, sparking fear and abruptly halting its use. As of today, 2025, under 5% of postmenopausal women in the United States are using hormone therapy. The WHI study became one of the most influential and damaging studies in women's health. It released and left millions of women without treatment, and many physicians stopped learning about menopause care, which created a gap in knowledge that persists today. Later reviews of the WHI study revealed some major flaws. There was age bias. The average participant in the study was 63, well past menopause, when baseline risks for heart disease and cancer were already higher. It applied a one-size-fits-all assumption to the medication. The study only tested one type of hormone, yet applied risks to all hormone therapies, ignoring differences in other formulations and deliveries. And it exaggerated the breast cancer risk. The initial claims were way overestimated, and the actual added risk was just 0.08%, which equates to 8 women in 10,000 women per year diagnosed with breast cancer, far lower than the risks of alcohol, smoking, and obesity. The fallout from this study led to generations of doctors who received little or no menopause training. And even if you survey today's OBGYN residency programs, only 1/3 of them are even teaching anything about menopause in their curriculum. Millions of women were told hormone replacement was dangerous when it was often the safest and most effective treatment, and misinformation still prevents access to evidence-based menopause care today. So why does menopause matter? Well, heart disease, it's the #1 killer for women, claiming more lives than all cancers combined. Estrogen protects the heart, the blood vessels. Without estrogen, we see a 20% increase in your bad cholesterol. After menopause, the risk of heart disease, stroke, and blood pressure rises sharply. Women also face twice the risk of dementia compared to men, with decline beginning decades before symptoms appear. Estrogen supports memory, mood, cognition. It also accelerates brain aging when it's low, leading to higher risks of dementia and cognitive decline, and increased risks for depression, anxiety, and mood disorders. 1 in 2 postmenopausal women will also experience a bone fracture or bone loss known as osteoporosis. Women can lose up to 20% of their bone mass in the first 5 to 7 years after menopause, and an additional 10% loss every 10 years if you're not treated with hormone. Hip fractures cause up to a 30% higher risk of death within a year of having that hip fracture. Beyond the symptoms and the major health effects that I've already covered, menopause also influences many other systems in your body. As I mentioned earlier, there's over 100 symptoms. So weight gain, increased abdominal fat, lower bacterial diversity in the digestive tract, orthopedic inflammation, frozen shoulder, hip and back pain, muscle joint pain, something called genitourinary syndrome of menopause, which is a constellation of urinary and vaginal symptoms, dental problems, cavities, gum loss, tooth decay, insulin resistance, diabetes. I mentioned hair loss and skin thinning, sleep disruption, and whole body inflammation. So let's return to my earlier point. Hormone replacement therapy is not only safe, it's profoundly beneficial for most women. In fact, studies show it can lower all-cause mortality, also known as your risk of dying, by 40 to 60%. Yes, you heard me correctly. Hormone can cut a woman's overall risk of death nearly in half. It reduces the risk of heart attack and stroke, reduces the risk of bone loss and fractures, and reduces the risk of dementia. So I encourage you to take what you've learned today back to your healthcare provider, ask the questions, start the conversation, and advocate for the care that you deserve. Your health is totally worth standing up for. The fear created by the WHI study was disproven by a multitude of research, but the damage still lingers. Many women, even healthcare providers, remain afraid of hormone therapy because of a lack of evidence-based education and outdated fears rooted in flawed data. As a result, too many women are told to just live with it when they could be getting safe, effective relief and protecting their long-term health in the process. The truth today is hormone replacement therapy is not just safe, but immensely beneficial for most women. So now that you've the knowledge and tools to confidently advocate for your health, it's time to shift and turn toward another form of empowerment, your wealth. You might be asking yourself, why is a gynecologist talking about finances? My answer is simple, because it has everything to do with a woman's well-being. Taking charge of your health builds strength. Taking charge of your finances builds freedom and security to create the life you want. Together, these two forces, health and wealth, are not separate paths, but parallel ones, each fueling each other. So let's review financial literacy by the numbers. Baby boomers and the silent generation are getting ready to pass a total of $84 trillion in assets by 2045, with 72 trillion going directly to their heirs. Yet, only 22% of women passed a financial literacy assessment. In the age of market volatility, rising costs of living, and shifting economies, financial literacy isn't optional. It's a survival skill. And women now more than ever need to master their finances to protect and grow their wealth. Let me share some eye-opening statistics. 40% of women cannot cover a $400 emergency. That's by the Federal Reserve. Women live longer but retire with 30% less wealth than men, according to a census with AARP. And only 37% of African American women and 29% of Hispanic women even have a retirement account. These numbers aren't just statistics, they reflect women's everyday struggle and missed opportunities. The more you know, the more you keep, grow, and protect. So let's look at the 5 most common financial mistakes women make. The first is lifestyle creep. When your income rises, your spending increases. We're all guilty of this. We strive for a bigger house, a nicer car, vacations, jewelry, luxury items. Number 2, women rely solely on their W-2 income and never build other streams of income. The only way you can make more is to work more. And now you're essentially trading time for money forever. Men, how many of you have other passive income streams? The third is overpaying taxes. Are you taking advantage of every tax strategy, or do you even know what those tax strategies are? How many times a year are you meeting with your accountant? Is it just once a year to file your taxes? If that's it, you're missing out. Number 4, not investing enough early or often enough. Many women delay investing due to a lack of time, fear, or tendency toward analysis paralysis. Women are more likely than men to avoid risky decisions, even if risk-return trade-offs are favorable. Do you automatically put deposits into your retirement account every month? Fear often holds us back from taking action because our brains are hardwired to protect us from risk, prioritizing safety and familiarity over growth and change. And lastly, a lack of financial education leads to poor decision and missed opportunities. So I want to ask you, who taught you how to manage your finances? Did you have to figure it out on your own through trial and error? The studies show that only 16% of women ages 40 to 65 have ever received any formal financial education. And among African American, Native American, and Asian American women in that group, that figure drops to 8%. These mistakes are fixable once you become aware of them, but nothing changes if nothing changes. As I mentioned, most women rely on one income stream, their paycheck. But what happens if you get injured or burned out or you want to scale back? You're stuck. The average millionaire has 7 income streams. Multiple income streams mean multiple safety nets, more freedom, and the ability to say yes to what matters most and no to what doesn't. Diversifying your income isn't a luxury, it's a necessity for sustainable wealth, and this is what wealthy people know. If you're only earning when you're working, you're capped, and that leads to exhaustion. Passive income earners retire 10 to 15 years earlier than people who do not have passive income. So it isn't optional, it's survival in a burnout culture. Financial strain, it also impacts your decisions and your relationships. Financial issues play a significant role in marital stability and divorce rates. And studies indicate that financial problems contribute to 40% of divorces, highlighting the impact of monetary stress on relationships. And after divorce, women experience an average of 41% decrease in their financial standings compared to men. This disparity is attributed to the factors like wage gap, childcare responsibilities, and the concentration of women in lower paying occupations. In addition, widowhood also significantly increases financial vulnerability for women. Household incomes drop by up to 40 to 50%. 60% of new widows are living below the federal poverty level, and 39% are carrying over $25,000 in debt. The statistics highlight the need for financial literacy early in life, proactive financial planning, and long-term care preparation. So far, I've focused on how a lack of financial literacy can affect your bank account. Let's talk about how financial illiteracy can affect your health. You can't build a legacy from a hospital bed. Chronic stress weakens your body, your brain, and your ability to work. And here are some key connections between health and wealth. Financial stress equates to physical stress. So according to the Journal of American Medical Association, chronic money stress is linked to increased rates of high blood pressure, insomnia, and heart disease. The risk of a heart attack is 13 times higher when financial stress is present. Second, medical debt drives bankruptcy. 62% of United States bankruptcies are linked to medical debt, even for those with healthcare insurance. Third, poor health reduces lifetime earnings. Chronic illness can reduce your lifetime income by 15 to 20% due to missing work or having to take retirement early because of your health issues. And people in the highest income brackets live 6.6 years longer than those in lower brackets. Burnout increases the number of sick days by 63%, and health crises can derail your financial plans. A single health event without adequate coverage or savings can wipe out years of financial savings. And financial stress reduces your cognitive performance. Worrying about money literally shrinks your mental bandwidth and your decision-making ability. You are your greatest asset. Investing in your health is investing in your wealth. So I don't want you leaving today's webinar with nothing but doom and gloom. So let's discuss how financial education improves your health. We know that wealth reduces burnout. Higher incomes equal longer life expectancies, and people in the top income brackets live longer. Financially literate individuals have lower rates of anxiety and depression, so understanding money leads to greater confidence. Adults in good health build up to 50% more wealth by retirement than those in poor health. So raise your hand if you exercise regularly. All right, well, exercise and income are linked. People who exercise regularly earn up to 9% more than those who don't. So who's ready to start exercising? Wellness investments you make in yourself yield a financial return on investment threefold. For every dollar you spend on a wellness on yourself, it returns $3.27 in reduced healthcare cost and absenteeism. So go and exercise. So you can optimize what you don't understand. Financial literacy is one of the most valuable tools you can use to reduce stress, enhance your life, your quality of life, and safeguard your future. When you understand how money works, you keep more of what you earn and you use it to create freedom. It's not about spreadsheets, it's about smarter decisions. So I want to ask you, what is your next best step toward health? Don't let this be another talk. I want you to either advocate for your health today or enroll in a financial literacy course. Don't be the broke, struggling woman who gave everyone. So you don't have to master it all. You just need to learn enough to stop being mastered by it. And your passion is your most precious gift, but it doesn't have to be your only income. Real power comes from learning, surrounding yourself with the right people, and taking smart, intentional steps. So as a thank you for joining me today, I'd like to gift you 2 valuable resources to help you start advocating for yourself and making real change. The left QR code will take you to my Take Your Financial Temperature quiz so you can really see where you're starting. You can't have a roadmap if you don't know where you're starting. And the second QR code on the right will allow you to download a complimentary menopause myths and facts guide that you can share with your provider so you can start advocating for your health. So I'd like to thank Lindsay Listansky, What Moves Her, and Coldwell Banker for hosting me today. And thank you to all of you for attending. I'll open the floor up to any questions that you might have.
Amazing content, Tracy. And I started it by saying, do something today that your future self will thank you for. And I think you gave us a million reasons why that is so important. We all are so busy, and making time for ourselves is so crucial to our lives personally and professionally. So thank you so much. We did promise everyone that we'd open it up for questions. I saw some people already using the chat button, which is great. So I'm going to give you your first question. And then if people want to raise their hand and come off mute, or they want to submit questions, that's fine as well. So Tracy, our first question comes from Pam. And her question to you is it better to talk with your OBGYN or general practitioner for hormone replacement therapy? Neither of hers have ever discussed it with her.
Yeah, so that's a great question. The answer is it depends. It depends on whether either one of them have received any training in menopause and hormone replacement therapy. You can go to menopause.org. It's a great resource for women. And there are some physicians out there that are, teaching valuable evidence-based information, and they too have referral bases for doctors that are certified in menopause care. Menopause.org has a certification program for healthcare providers that they can take, and they list those on the website that have taken the certification. This is something that came out in the last, I would say, 5 years. I happen to not be on that list simply because I received the training in my residency program. But it really depends, and I come across some practitioners that are very up to date, and then some that are operating off of the old, 2002 study, unfortunately.
Fantastic. Thank you for that. Our next question comes from Andy, and her question is, what are your thoughts about women's healthcare under the current administration? Is there something we should or can do to ensure women's healthcare is protected and that research and funding studies should continue? Now, we are at work, so I want to be careful with talking about politics, but if we can keep it in a non-divisive, polarizing answer, that would be super helpful to everyone.
Yeah, agree. So, regardless, I think, again, it comes down to the lack of funding for women. And thankfully, due to the menopause kind of drive that's happening right now on trying to educate women about menopause and perimenopause, there is a drive coming from multiple foundations right now to improve funding for women. And this is one of the things that I teach many of my patients and clients about. We are severely underfunded when it comes to women's research. And as a result, a lot of the studies out there are based on men, and we know women present completely differently. And heart disease is one of those biggest examples. And so thankfully, I would encourage you to reach out to your, local congressmen and senators. There are petitions going around to support funding for women. And I know the Gates Foundation just announced, several $billions in funding that they plan to put towards women's research. The biggest part of this is education and getting your information from a quality source. And it's so hard with social media to know what is quality and what isn't. I think at the end of the day, you have to have these conversations with your healthcare providers.
I'm going to combine the next two questions from Laura and Paula, and the combination is they've heard mention of age window for HRT. Can you touch on that? And also, as women approach that age, how could they start thinking and preparing for menopause?
Yeah, so two great questions. So the first question is the age related. So we know and we have data that if you start hormone replacement therapy within the first 10 years of being menopausal, you get the best benefits out of it. But that's not to say that if you're outside of that 10-year window, that you're not going to still reap the benefits of hormone replacement therapy. It really depends on what your current health picture looks like at that point. So, for instance, I am starting some patients on hormone in their mid 60s and even their 70s because they missed the opportunity when the WHI study came out and everybody stopped prescribing hormone. It really just depends. And so we look at, what is your heart disease status at that point? Do you already have, significant plaque and blockages? Are you really not going to reap any benefit from a heart protection standpoint? I have to say, there are a lot of women in their 60s and 70s that don't have any evidence of heart disease yet, maybe haven't lost a lot of bone yet. They're great candidates. So it really depends outside of that 10-year window. But for sure, if you're within that 10-year window, there are substantial longevity benefits for you. Tell me the second question again, Lindsay.
Basically, how can women start preparing for it?
So yeah, so I think the best thing you can do is, you may start having symptoms in your mid 30s. And I think the more you understand what the symptoms and signs are, that it's not just hot flashes and night sweats, the more you're going to be able to identify this could be menopause. And having those conversations with a healthcare provider that is familiar with this space is going to help tie it together. I frequently see patients that, over the last, if I ask them to reflect back 5 years, they don't realize that they've been having symptoms all along because they don't put the common thread of symptoms together. And, there's, again, a lot of misinformation out there. So I gave you a slew of symptoms today. I hope that opens your eyes to the fact that it's not just menopause, is not just hot flashes and night sweats.
Tracy, we're at time, but people are hanging. Do you have maybe 2 to 3 more minutes, 5 minutes? Okay, so
I have all the time. Yeah.
you are amazing. Thank you. These are such important questions, and I would hate to rush through them. I know Pat Palumbo has had her hand raised for quite some time, so if you'd like to come off and ask your question, Pat, you may.
Hi, Lindsay, and hi, Doctor. Thank you so much for your information. It's been vital. And
Mhm.
I think part of combining the physical and the work is just recognizing when it's truly overwhelm and we have to revisit our scheduling, or when a typical week that never has bothered us is totally like taking it on. So, can you give some tips when we're having those weeks, how to deal with them when we know that it's more a physical thing than a big change?
Great
Yeah,
question.
that's a great question. So I think the first thing is we tend as women to just plow through and deal with it. I think the first thing is putting the pause button on and just saying, like, I am not effective when I don't feel well, right? You're not going to accomplish what you can when you're not feeling well. You can't focus. You can't find your words. You're tired. You're not sleeping well. You're not recovering. So I think the first thing is putting the pause button on and just setting some boundaries for you. I recently read a really great book, about buying back your time by Dan Martell. And he talks about blocking out your schedule and stacking things so you accomplish, you hit two tasks with one activity. And so I've learned to cut out a lot of the nonsense work that, gobbles up your time, like going through 6 email accounts and going through 600 emails a day. I was just talking about this earlier. That's the first thing, giving yourself a chance to get back to basics. I can't tell you how important sleep, nutrition, exercise, that is going to fuel you for when you're not feeling well. And, hormone replacement isn't going to fix everything if you don't address your nutrition, your sleep, and your activity. It's going to help, but it's not going to fix everything. So I think you need to find a way to prioritize you time to be able to recover.
Our
Thank
next
you.
question, thank you, Pat. Our next
Yeah.
question comes from Grace. Can you please share any alternatives to HRT if you are a breast cancer thrive? I think she meant to say survivor, but perhaps thriver?
Yeah, so that's a great question. So there are a ton of options for women who were diagnosed with breast cancer that maybe are not candidates for hormone replacement. And the reason I say maybe is there are some breast cancer survivors who are candidates, believe it or not. So the common misconception is that estrogen caused breast cancer. That is not true. It's the progesterone arm of the original study that suggested the risk for breast cancer was slightly elevated. What we are finding in more recent studies over the last 5 to 10 years is that estrogen actually lowers your risk for breast cancer by 30%. So for those women who were treated or are actively being treated for breast cancer, and they have an estrogen receptor positive type of cancer, then yes, we can't give them estrogen while they're undergoing treatment. We don't have enough studies yet to know if we can start treating them after, although there are some studies in process. But there are other things like Veoza, which is a medicine that helps with hot flashes and night sweats it's not hormonal. We also know that we can safely treat women with vaginal estrogen because many women experience dryness from the estrogen loss and pain, itching, burning, you name it. And so we know we very well safely can treat women who are actively being treated for breast cancer or had breast cancer with vaginal estrogen because it acts locally. It does not go systemic, and it helps tremendously for those patients. So there are a ton of different treatment options. I just named two that can help with your symptoms so you don't need to suffer.
Excellent. The next question comes from Emily. Listen, a lot of the symptoms that you talked about, we've had, right? Whether you're in menopause or not, right? So is there Emily wants to know, is there testing an OBGYN can do to see if we're going through perimenopause, if they're experiencing a lot of the symptoms that you listed?
Yeah, that's another great question and a difficult one. So the challenge is when you haven't gone through menopause yet, your hormones are fluctuating daily from day to day, week to week, month to month. They're never the same. And so you can check hormones, but the problem is that your hormone range may come back normal, and it's because you're just capturing a single data point in a large amount of time. It would be optimal if we could map out your estrogen and progesterone every single day, but that's not realistic to draw blood every day. And so really it's your clinical symptoms and having your healthcare provider know how to piece those together and know that it's perimenopause or menopause versus something else. Once you get closer to being menopausal, it gets a little easier and the blood work tends to be more clear. But that's mainly why the American College of Obstetrics and Gynecology doesn't require you to have blood work drawn in order to know if you need to start hormone. It's really based on clinical symptoms. That's not to say I still don't check them. I do. We start to see patterns as we check them over time, but just keep in mind that one blood test may look fine on paper, but in reality, you are definitely having symptoms and warrant treatment. So you don't have to wait till you're menopausal to start treatment for hormone replacement.
All right, I really appreciate you going almost 10 minutes over time. I think we got to almost every question in the chat. If we didn't, I know that we can certainly connect you with Dr. Verrico. Tracy, I don't say this lightly. You either changed or saved lives on this call today, and that gift is invaluable. So thank you for being so generous with your wisdom. If women would like to follow you, stay connected, what's the best way to do so?
Yeah, so you're welcome to follow me on Instagram or Facebook at Dr. Tracy Verrico. I'm happy to, help in any way I can. I'm always posting things. You can sign up for my newsletter on my business website for our gynecology practice. It's a free newsletter where I talk about health and wealth. Every Sunday, you'll get a newsletter. And then, reach out to me. I'm always happy to, connect. I'm happy to talk. I'm happy to grab a cup of coffee. So I'm here, happy to do it.
Amazing. Nicole said it best, knowledge is power, and we are coming from a position of power when it comes to our health and wealth. Thank you for joining today. I could never end a What Moves Her event without thanking my right hand, Ashley DeLappy, who drives What Moves Her forward in partnership with me. So Ashley, thank you for all you did to help with this event. Please continue to stay connected with What Moves Her. Head to the website, subscribe for our newsletter. We send something out every single month. Also follow us on Instagram. We post every week at What Moves Her. Tracy, thank you, a million thank yous for being so wonderful. And thank you all for taking time to invest in yourselves today. That is the most important thing. And that is why Sue Yannicone founded What Moves Her. It is to make sure that we are reflecting and taking time for ourselves on our journeys in life, personally and professionally. Have a great day and keep your eyes out for our next What Moves Her event. See you all soon.
Bye. Thank you.
Thank you.